Allied health profession workers have asked government to intensify the provisions of the required personal protective gears to health workers in the fight against the spread of Ebola. Addressing journalists in Kampala, the President Allied Health Profession Workers Alliance Uganda, Dennis Alibu, said whereas health workers are fighting to save Ebola patients, most of them are scared as they lack adequate protective gears.
You either attend to the case with the PPEs or not. And that's why we are here emphasizing to government that to help health workers do their job. You had in Mubende Hospital somewhere, health workers were fearing to do their job. It's simply because this is a deadly virus. Okay? So to health workers, certainly who are not able to have these PPEs, there is no way they can attend to patients in this case. That's why we are emphasizing that government should be on their footprints to ensure that PPEs are delivered timely to the facilities. It's just like a warfare. If you're surrounded by rebels and you don't have ammunition, guns, you cannot manage to confront the enemy. So PPEs are tools that health workers use to be able to confront enemies, which is in this case is a disease. So all health workers that have no PPEs cannot be able to do or respond to this. Of course, our call to the health workers who have not got PPEs through their line managers, they should follow up with the ministry or respective heads to ensure that PPEs are there such that we help our people whenever they succumb to this condition.
So far, 4 health workers have succumbed to Ebola and are said to have contracted the virus while on duty. They emphasize the need to compensate health workers' families who have succumbed in the line of duty.
We are here to emphasize that compensation is upheld, and according to the Compensation Act, health workers who succumb to such conditions and loss of life should be paid 60 times their salary in this case. And at the moment, the families of these people who have lost their loved ones, of course the breadwinners who have been the health workers, certainly are on track or are being tracked to see that they get this necessary help. And us as leaders, it's one of our role and duty to ensure that we follow this up. And indeed, it is on our agenda.
Health workers have been cautioned to be vigilant while executing their duties and not to attend to any patient without protective gears.
So I encourage the government and all stakeholders to take note of the issue of providing adequate information and especially the PPEs to our people to prevent them from contacting such an infection. In between these outbreaks, we should make sure that we have mechanisms in place. We have committees that can plan better, have better research. Every time we have such infection, every time we have such outbreaks, we shouldn't be having reactionary kind of approach, whereby any outbreak comes, then we just react to contain it, instead of having better research-based protocols that in case such a thing comes, we are well prepared.
As we serve the communities, and we should also have some hope that while you serve, perhaps when you acquire a disease like this one, you should have insurance, and probably when you die, you should have compensation. We are aware that the Workers and Compensation Act, that now is the Occupational Health and Safety Act, talks about a compensation of up to 60 times the salary of a person or a health worker who has died in line of duty. So we are having health professionals, including allied health professionals, dying, not only this time, but even COVID. We lost many of them. We have been documenting, and we have big numbers of lists that haven't been compensated. So we ask government to work on insurance of especially medical professionals, because this shows you that emerging diseases are just going to continue.
Florence Alezio, the Vice President, Psychiatric Clinic Office, has emphasized on the need for psychosocial support to survivors of Ebola disease to restore hope to survivors.
But due to the risks in this Ebola, people are not able to give that people are not able to give that care that they're supposed to give, look after their sick people, and it becomes a threat to them. People go through not mental assessment, but mental help, psychological help. Then such things the fear will go out, they're able to interact and so on. Because when they talk of Ebola, it's not the whole country that has got the infection, but a particular section of the country that has been affected. As we work in our environment, we need to be safe, we need to protect ourselves, and we need to be able to give care to the community and our clients. We should have access to social and physical and emotional support, and that's what we are doing. I really thank Ministry of Health through Dr. Hasfa and Dr. Kalanyi who have come up timely to give support to our health workers in Mubende and to the community at large. As some of these clients are improving and going back into the community, this is the time when they need a lot of psychosocial support in order to interact with the community, in order to fit back into the community in which they came from.